mean, I've had surgery on my left foot. I've had bilateral knee surgery with my knees.
Okay.
But I also noticed, and I wasn't going to try to steal the show, when you sat down and got up, sat back down, I had a doctor to also wonder why I was so slow getting up. I actually do this to get up. And I know some of it is with age, because it wasn't always that I had to use something to get up. And I'm slower getting up.
Possibly with both your knees being replaced as well, but
well, I want to put it on that, but I also I have a breathing problem.
But eventually, if you think about it, if your diaphragm starts being used for breathing, and so you put all your weight starts just going down, you get your pelvic floor. That is used to hold everything up as well with your posture. A lot of women have urinary incontinence from it. Men, it could happen too, but women, it happens a lot. And that's from not holding yourself up because you try to breathe. And it's unfortunate that you have a disease where you want to breathe, but you can't live without breathing. So your body's doing whatever it can, taking every single resource it has to help you breathe. And there's other things that get left behind. So those are different things. So your core, and that's what it is, your core muscles are being used to breathe, and your balance gets thrown off, and not being able to hold up your whole thorax is thrown off as well.
There's lots of spirometers and things like that out there, and also some practice for respiratory and actuatory. Are they good for pulmonary fibrosis? Do they help at all?
They do.
What's the question?
So there's a lot of spirometers and different types of activities that you can use at home to do breathing exercises. That's your question, correct? Do they help? And do they help for pulmonary fibrosis? I believe they do. And the reason I believe they do is because you're working your muscles. And you're working on focusing on your breathing and taking deep breaths in. The more you sit around and the more you lay around, the faster your disease is going to work on. Some of it you can't stop. Some of the progression of your disease you cannot stop. But the more you work on keeping your lungs moving, keeping them compliant, keeping them opening up and closing back down, the better they are going to be. And also, as we age, we lose lung function just naturally as we age. So even though you go in for PFTs, and it might be every 6 months, every year, every 2 years, your numbers are going to come down naturally because we all age. I think anything you can do to take a break during the day, to think about your breathing and take deep breaths and let it out, or even think about your diaphragm, which is going to be different breathing than it's let your stomach. So your diaphragm comes down. It'll be very good.
You held up the chart. What are some of the newer medicines that are out?
So some of the newer ones are, some of the newer ones on here, like Ultibron, that one is just for COPD. And I don't know much about it. But it has an old medication, which is glycopyrrolate. That's an old medication that's mixed with in Decadural. These are medication names. I'm not good at them. But there's also other new ones that are not on here. My patients come in, I ask them what they're on, and they tell me, and I'm like, well, let me look that up because I haven't heard of that before. There are so many. So what they do is they look at the way these inhalers work. They target different receptors in your lungs. Some of them target directly to the receptors that relax your smooth muscle. Some of them target receptors indirectly, which is the backdoor method to relax your smooth muscle. Yes, ma'am.
I'm thinking, I think it's a new inhaler, Trilogy Ellipta,
Okay.
and that really has helped me.
Very good. I'm going to look into it. Does it have multiple medications in it, do you know?
I don't know.
Is it powder or?
Powder, yeah.
Okay.
Did you say that was Trilogy?
Mm-hmm.
I saw that in a commercial, I think it has 3 medicines. That's why it's called Trilogy.
Yeah.
It has 3.
Yeah,
I don't know what they
I
are
don't know.
That would make
I only
sense.
take it once a day.
Okay. And if it's ellipta, then it's like these different little ones where it opens up to the side. Okay. So there's the different delivery methods. There's the different types that come out. It's either the meter-dosed inhaler, which is the regular spray. There's the powder. There's the slow-moving mist, and then you have your old nebulizer. A lot of people don't have a nebulizer at home. Some people have them and they feel like it works a whole lot better than the inhalers. So you gotta find what works for you and what fits into your lifestyle. Yes, ma'am.
Would you know which ones are best for the people that have COPD and asthma? I know the commercial lots of times will tell you if you have asthma, this medicine's not for you.
So I'm wondering if maybe that statement is to protect themselves from, I'm thinking it's to protect themselves from an asthmatic trying to use it as an emergency inhaler.
I didn't
But-
take it that way.
But I have to look into it because these are the new drugs that are coming out for COPD.
What would be
And
like
not-
one that's been on the market for a long time that might agree with a lot of people that have COPD
Yeah.
and asthma? I'm wondering. One that's been around for a while that's working good for people.
The Anoro seems to work really good for people.
Does it?
With asthma,
Symacort's
For
fantastic.
both? For both?
Sorry, what?
A neuro is for both COPD and asthma?
Anoro says that it's for COPD, but it seems to work very well. It's still a dry powder inhaler. And if y'all have preferences where the dry powder inhaler just makes you feel like you're getting choked up, some people don't like that. Like you said, Symbicort. Some people really, really like Symbicort. Their insurance doesn't pay for it.
The Anora did not help me.
And that's where you get the Trilogy from, or whichever one that is. I'm gonna look it up. And then there's there's Dulera. Some insurance companies say, we won't pay for Symbicort, but we'll pay for Dulera. They're supposed to be comparable. They do have different formulations in them. You try them. It's confusing. This is why you have medical professionals. It should be.